uh, the input of Anthony Fauci. I went against Anthony Fauci some years ago when I was writing extensively upon AIDS. And what we found is that one day a woman came into my office, a very tall, thin woman, and she had about a foot stack of documents. And she said, "Would you look at these?" And I said, "Who are you?" My name is Lynn Gannett, and I am one of the observers in the AZT clinical trials occurring at University of Rochester and Syracuse and the other universities. And she said, "It's a complete fraud. I've written all these letters. Here are copies to the FDA and the compliance officers of the FDA showing them that people are dying. They're being excluded. People are tasting the tablets, opening them up. And if they taste sweet, then they realize that's a placebo, milk sugar. So they're all using AZT and they have all these side effects." And she said, "They're going to fast track it." Well, they did fast track it. Now, here's how it ties into corona. I was working with people for 10 years before it was called AIDS, when it was a gay men's irritable bowel condition, and a Dr. Stephen Kaiser, the leading gay physician in New York, or one of the top gay physicians, was working with me. He was sending me his patients, and I was working with them and helping them through diet, lifestyle change, and recolonization of the gut with healthy bacteria, et cetera, and vitamin C drips, getting their health back. Well, when all those people began to show up and were tested and were HIV positive, but otherwise completely healthy, that there was nothing wrong with them. And they started to take AZT. And the moment they started taking AZT, otherwise healthy persons who were HIV positive by a false antibody test that Gallo owned the patent on, they started to die. And then I looked at the package insert for AZT, and one of the very first things it says is that AZT can cause AIDS, that you can virtually indistinguishable. So were people dying of HIV, the virus, or were they dying of the treatment? And we estimate as best we can, and it was Professor Kary Mullis who was talking with me at the time, and a Dr. Stroman out at the University of California, Berkeley, who I filmed, and they believed that about 250,000 Americans died from the treatment, and yet nobody would look at it. It was politically unacceptable to challenge anything about it. You couldn't. You were suddenly an AIDS denier if you challenged anything. Now come forward, now Bill Gates and others are rushing in to production untested in any clinical animal or human studies, any in-depth ones. And I believe we're going to see something at a far worse scale of potential side effects as we did with AZT, but 1,000 times worse, because this is going to be mandatory. AZT wasn't mandatory. This is going to be mandatory. It already is. And New York, the New York State Bar Association just last week said that they expect every single person in New York State, with no exceptions at all, no allowances, every single person in New York State is going to have to take the coronavirus vaccine. And the same is true in California. Your thoughts, please, and the role Bill Gates is playing in all this.
Well, it is a nightmare scenario that's unfolding, and on a very specific note that we can already point to of the treatment actually killing people rather than the disease is played out in the first stages of this pandemic scare, where people were, of course, people might remember that part of the whole flatten the curve, the reason we have to lock down, or at least the ostensible reason that was being given to the public, was because we were going to run out of ventilators. This disease was causing people to need ventilators because it was a respiratory virus, and it was going to start killing people that way. So we need ventilators. And you might remember there was the scramble. How are we going to produce so many ventilators? How are we going to set up these field hospitals that ultimately ended up being completely empty and closed down without a single patient? Well, part of that was this rush to get ventilators. And as it developed, people, I think, in the general public maybe don't have the experience to know that putting people on ventilators is an extremely serious medical intervention. And even in the best of cases, just generally speaking, 40 to 50% of patients with a severe respiratory distress or disease will die on the ventilator. But in the case of coronavirus specifically, what was happening in New York City and elsewhere, over 80% of the patients that were being placed on the ventilators were dying. So there is and that as a result of that, doctors started moving away from putting patients on ventilators and stopped using it as liberally as they were before. So in that case, yes, the treatment can actually be the thing that is killing people. But of course, as Deborah Birx and others have noted during the course of this virus, and anyone who was dying with COVID-19 was being classified as dying of COVID-19, regardless of whether it was the ventilator or anything else that killed them. So that is how we have come up with this startling and breathtaking 100,000 plus U.S. Americans have died, and all of this hype that has surrounded this. And as you say, the implications for that are orders of magnitude worse for the idea of a experimental, untested vaccine that is going to be forcibly injected in hundreds of millions, billions potentially of people around the world. It is unimaginable what is happening right now. And one of the people who has been behind this push for this idea of vaccinating the entire global population has been Bill Gates. In case people have been living under a rock for the past decade, Bill Gates has come to the fore of the global health infrastructure as essentially in the way that Microsoft attempted to monopolize the personal computers and at least take over the operating system space back in the 80s and 90s. Well, Bill Gates has essentially done the same thing in the field of public health. And this isn't just myself talking. This is even publications like The Lancet were pointing this out back in 2009 when they were starting to warn about the growing influence of the Gates Foundation. And that was before the Bill and Melinda Gates Foundation announced their decade of vaccines, where they were going to invest $10 billion in providing greater vaccine coverage, part of which was to be done through the auspices of an organization called Gavi, the Vaccine Alliance, which was co-founded by the Bill and Melinda Gates Foundation, and which partners the UN and the World Health Organization and foundations like the Bill and Melinda Gates Foundation with the vaccine manufacturers to, in their own words, and you can go read this on their own website, with the express and explicit purpose of creating healthy markets for vaccines. That is part of what the Gavi Vaccine Alliance is there to do. Of course, that's what vaccine manufacturers want. They want healthy markets for their products. So they are explicitly involved in this conflict of interest where they are absolutely for profit going out trying to inflict as much vaccination on as much of the global public as possible. And so it is perhaps no surprise whatsoever that one of the leading voices during this time of the coronavirus panic has been Bill Gates. He has been turned to by any number of media outlets that, oh, by the way, tend to be funded, at least partially, at least in their global health coverage, by the Bill and Melinda Gates Foundation.